So, how does diabetes mellitus kill? Most diabetic people have a 75% chances of dying from cardiovascular disease or stroke, and are likely to die at a young age. Having diabetes puts you in a cardiovascular risk as though you have had already a heart attack. Diabetes is a leading cause of blindness around the world. Limb amputations, 15 to 40% more in diabetic patients than non-diabetic. Impotence or erectile dysfunction affect diabetic patients 8 to 13% and before the age of 50. After the age of 50, the risk is high as 50 to 60%. And the risks are endless. The question is, how do all these things happen? I'm glad you asked. The hyperglycemia or high blood sugar level kills your system in two mechanisms. Number one, the formation of atherosclerosis, and number two, the advanced glycation end products. At DrMuraHealth, because we believe you're intelligent enough to understand the concept pertaining to your health, in this video, I'm going to show you how this complication can occur, and towards the end, you don't want to miss this. I'm going to give you opportunity to be able to join the DrMuraHealth Diabetic Solution Program to really tackle this condition, prevent all these conditions. So please don't miss any second of it. Hi, I'm Dr. Mura, a certified lifestyle medicine physician and co-founder of DrMuraHealth. DrMuraHealth equips you with evidence-based, practical, scientific methods on how to prevent, treat, and even reverse some of these chronic lifestyle-related conditions. This will be video number 5. If you would have missed any of our previous video, please do go and check them to understand the context of this video as well on our YouTube channel or our Facebook page. And don't forget to like, follow, and also turn that notification on so that you won't miss our future video. Now, in two main categories, diabetic complication can occur. Category number 1 is what we call microvascular angiopathy. Now, prolonged exposure to hyperglycemia is now recognized as a major factor in pathogenesis of atherosclerosis. So hyperglycemia is going to induce a large number of alterations at the cellular level of vascular tissue, which potentially accelerate atherosclerotic process. Now, you may be wondering, what is atherosclerosis? So atherosclerosis is a condition where the arteries are hardened and narrowed due to buildup of plaques or fat in your arterial wall, and this can lead to condition like a coronary artery disease. Now, coronary artery disease, basically you have vessels that are supplying your heart. These can be damaged or blocked, prevent oxygen and nutrient reaching in the certain parts of your heart, and that can lead to things like a heart attack. Now, this coronary artery disease, it is not only limited to diabetic patients. Other conditions such as hypertension, high cholesterol, they can develop this condition. But when it comes to diabetic patient, this condition is so severe, is so aggressive, and this atherosclerosis formation, they are so profusely present, and they happen at early age. That's why you have, if you are diabetic, you have 4 times more to have a cardiac event such as heart attack, and twice to have things like a stroke than non-diabetic patient. Other conditions that happen from this atherosclerotic formation is cerebrovascular accident or stroke. Again, the stroke happen with this, it could be a thrombi or an emboli that may be dislodging from that sclerotic plaques that can go to your brain temporarily or completely, but blocking the blood and oxygen supply, and the cell in your brain is going to die. And now, this can happen in diabetic patient. Again, other condition can in diabetic patient is even more severe. And so this atherosclerosis happen in major vessels and medium vessels. So from the abdominal vessels supplying the kidney, also going to your lower limb, your legs, small vessels are going to be occluded with this plaques formation, which can also cause a peripheral vascular disease. Now, the second broad category is what we call microvascular complications or microvascular angiopathy. And this mainly happens through the process and mechanism called advanced glycation end product. Now, this advanced glycation end product is a harmful compound that is formed when the fat and or protein combine with the sugar in the bloodstream. Now, this, by the way, advanced aggregation and products can happen in food as well that we eat, especially the food that will have been exposed to high temperatures, such as grilling, frying, or toasting. So if you always eat grilled meat, grilled or roasted meat, or processed food or high fats, you are basically increasing this. You are consuming a large amount of advanced aggregation and products, worsening your microvascular complication of diabetes. Now, with this advanced aggregation and product, they happen more in small vessels like capillaries. What happens is the capillary become thick, and not only thick, they become leaky, and there's a protein that it goes through and causing the neuron to be damaged. So the organs that can be damaged, we have diabetic retinopathy, your eyes. So the blood supply to your eyes, they become thick and leaky, and you have lipoprotein that comes sift through, which damages your neuronal tissue. That's why diabetes is a leading cause of blindness around the world. Coming down, you have what we call autonomic neuropathy. So there are certain function that is just automatically happen. Central nervous system, part of autonomic nervous system. As such, you don't have to think of breathing. You don't have to think of heart beating. So in patients that are diabetic, these changes are going to be affected. For example, if you lie down and suddenly stand up, ideally what would happen, because the gravitation force, the blood pull down, but that does not happen in healthy people, because you have sympathetic nervous system that fires up in the lower part of your body, constricting the blood back to the heart, supplying your brain, so that you won't have vertigo and blackouts. But a patient who's diabetic, if that happen, you stand up, the part of autonomic nervous system is not working, so they're going to have vertigo and blackouts. They can just have a postural hypotension. Other thing with autonomic neuropathy, what can happen is, of course, you have your stomach is supplied by the vagus nerve. Now, what happens in a diabetic patient, the gastrointestinal motility is changed because nerve supplying is affected. Even more important in theater is people who put the patient to sleep, because we have to worry about the full stomach, because then it can end up get the food going to the lungs and cause a further complication. Now, it continues even in the urogenital system. This will cause things like urinary retention, and is going to cause impotence, because basically one of the reason why you want to have erection is the blood flowing through the male genital organ, and this because atherosclerotic and advanced aggregation in the product, this part is diseased, so the blood won't be able to go through easily as should, and there want to be a failure of erection or for appropriate penetration. Other thing you can have, of course, we have autonomic nephropathy. So you have about 1.2 million of nephron in each kidney. Now, each nephron has a matrix of capillaries called glomeruli. These, with advanced aggregation and products, they're going to be diseased. And if nothing really happened, it's going to just lead to end-stage kidney disease. And that's why diabetics are one of the culprits when it comes to kidney disease. Again, we have a diabetic neuropathy. Now, peripheral nerve, because of course all the small vessels have become thick and also leaky, so the neuron affected, then you cannot feel. If a diabetic patient is barefoot, what will happen is you may injure yourself, you won't feel it, and then infection started kicking in, and then the hospital we do is very, very painful. We start amputation. You start with the toes, and then the foot, then the leg, and it's very, very painful. Diabetes mellitus complication, it really kills you slowly, bit by bit, and that's why we need to do something. So the complications of diabetes are endless. I'm just highlighting this to you, but these are very severe complications, and the problem is happen slowly with a long period of time. And that's why today, if you have watched the video that we did previously, we want to invite you to come to DrMuraHealth program, whereby we can tackle these problems from the root cause, because that's what I've been highlighting throughout the video, that there's something that has to be done at each stage of this disease. You don't have to continue to suffer these complications. There's something that it can be done. And if you have anyone to help you do that, we would like to be us. You probably have tried many things. It's time that you tried the DrMuraHealth Diabetic Solution Program. Thank you for watching.